Tragedy has struck the state of Kerala, India, once again. A 14-year-old boy has lost his life to the deadly Nipah virus. This heartbreaking incident has sent shockwaves through the community and beyond. The young boy, an aspiring cricketer, was well loved by his peers and coaches. Health officials are working tirelessly to contain the virus and prevent further spread. They are conducting extensive testing and monitoring to ensure the safety of the public. The situation is a stark reminder of the very real threat Nipah poses to global health. The virus, which can be transmitted from animals to humans, has a high fatality rate and no known cure. The young boy's death underscores the urgency of the situation. His dreams of becoming a professional cricketer were cut short by this devastating illness. We are reminded that Nipah virus is not a distant threat but a present danger. The virus has previously caused outbreaks in other parts of India and Southeast Asia, leading to numerous fatalities. His loss highlights the critical need for vigilance, rapid response, and international collaboration in the face of this deadly disease. Researchers and scientists around the world are working to develop effective treatments and vaccines. The Kerala government has acted swiftly, implementing strict control measures to prevent a wider outbreak. Schools and public places have been temporarily closed, and public gatherings have been restricted. Contact tracing is underway to identify and isolate individuals who may have been exposed to the virus. This proactive approach is crucial in stopping the spread of the virus. The coming days and weeks will be crucial in determining the extent of this situation. The community is urged to remain vigilant and follow the guidelines set by health authorities. The loss of this young life is a stark reminder of the fragility of human health and the importance of preparedness in the face of emerging infectious diseases. As the community mourns, there is a collective hope that this tragedy will spur greater efforts in research, healthcare infrastructure, and global cooperation to combat such deadly viruses in the future. The fight against Nipah virus is far from over, but with continued vigilance and collaboration, there is hope for a safer future. The Nipah virus is a zoonotic virus, meaning it can spread from animals to humans. It is considered a significant threat to public health due to its high mortality rate and the lack of a vaccine or cure. Fruit bats, also known as flying foxes, are the natural reservoir of the virus. Nipah virus infection can lead to a range of severe symptoms, including encephalitis, which is inflammation of the brain. The virus can also cause respiratory illness and, in severe cases, death. The World Health Organization, or WHO, has identified Nipah virus as a priority pathogen, highlighting the urgent need for research and development of effective countermeasures. The virus's ability to jump from animals to humans, coupled with its potential to cause severe illness and death, makes it a major public health concern. The lack of effective treatment options further underscores the need for proactive measures to prevent and control outbreaks. Nipah virus infection can present with a wide range of symptoms, making early detection challenging. This variability in symptoms often leads to delays in diagnosis, which can be critical in managing the spread of the virus. The symptoms can be mild at first, but they can quickly escalate, making it essential to be vigilant if you suspect exposure. The incubation period, or the time between exposure and the onset of symptoms, can range from 4 to 14 days. However, in some cases, it can be as long as 45 days. This extended incubation period means that an infected person may not show symptoms for an extended period, increasing the risk of unknowingly spreading the virus to others. During this time, the virus can be silently transmitted, making it a significant public health concern. The unpredictability of the incubation period adds another layer of complexity to controlling outbreaks. This means an infected person may not show symptoms for an extended period, increasing the risk of unknowingly spreading the virus. Early detection and isolation are crucial in preventing widespread transmission. Initial symptoms of Nipah virus infection are often flu-like and can include fever, headache, muscle aches, cough, sore throat, vomiting, and dizziness. These symptoms are common to many other illnesses, which can make it difficult to identify Nipah virus infection without specific testing. As the illness progresses, more serious symptoms can develop, such as disorientation, confusion, seizures, and encephalitis. Encephalitis, or inflammation of the brain, can lead to long-term neurological complications or even death. The progression from mild to severe symptoms can be rapid, underscoring the importance of early medical intervention. Encephalitis, or inflammation of the brain, can lead to long-term neurological complications or even death. The severity of encephalitis can vary, with some patients experiencing mild symptoms and others facing life-threatening conditions. The severity of Nipah virus infection can vary greatly from person to person. Some individuals may experience mild illness, while others develop severe disease requiring hospitalization and intensive care. The reasons for this variability are not fully understood, but it is believed to be influenced by factors such as the individual's immune response and overall health. Some individuals may experience mild illness, while others develop severe disease requiring hospitalization and intensive care. The need for intensive care can place a significant burden on healthcare systems, especially during outbreaks. Unfortunately, there is no specific treatment for Nipah virus infection, and care is primarily supportive, focusing on managing symptoms and complications. Supportive care includes measures such as maintaining hydration, providing pain relief, and monitoring for complications. Research is ongoing to develop specific treatments and vaccines, but until then, prevention and early detection remain the best strategies for managing Nipah virus outbreaks. Understanding how Nipah virus spreads is crucial for effective prevention and control. The virus, which can cause severe illness in both humans and animals, has been responsible for several outbreaks in South and Southeast Asia. By comprehending its transmission pathways, we can better equip ourselves to mitigate its impact. The virus can be transmitted to humans through direct contact with infected animals, particularly fruit bats, or through consumption of contaminated food products. Fruit bats, also known as flying foxes, are the primary carriers of the Nipah virus. These bats can infect other animals, such as pigs, which can then act as intermediate hosts, further spreading the virus to humans. Human-to-human transmission is also possible, primarily through close contact with infected individuals, especially those with respiratory symptoms. This means that the virus can spread within communities and even healthcare settings if proper precautions are not taken. It's essential to recognize the signs of infection early to prevent further transmission. Fruit bats, the natural reservoir of Nipah virus, can shed the virus in their saliva, urine, and feces. These bodily fluids can contaminate the environment, including fruits and other food sources. When humans come into contact with these contaminated items, they are at risk of infection. This highlights the importance of monitoring and managing wildlife to reduce the risk of spillover events. Humans can become infected through direct contact with these bodily fluids. For example, by handling infected bats or coming into contact with surfaces contaminated with bat droppings. This can occur in various settings, including agricultural areas, markets, and even homes where bats may roost. Ensuring proper hygiene and sanitation practices can help minimize these risks. Consumption of fruits or other food products contaminated with bat saliva or urine can also lead to infection. It's crucial to wash fruits thoroughly and avoid consuming any that appear to have been tampered with by animals. Public awareness campaigns can play a significant role in educating communities about these preventive measures. Human-to-human transmission of Nipah virus typically occurs through close contact with infected individuals, particularly those with respiratory symptoms. This can happen in households, healthcare settings, or any place where people gather closely. Wearing masks, practicing good hand hygiene, and maintaining physical distance can help reduce the spread of the virus. This can include caring for a sick person, sharing eating utensils or personal items, or coming into contact with their respiratory secretions, such as saliva or mucus. Healthcare workers are particularly at risk and should use personal protective equipment to safeguard themselves. By understanding these transmission routes and taking appropriate precautions, we can better protect ourselves and our communities from the Nipah virus. Sadly, this is not the first time Kerala has faced the threat of Nipah virus. The state has experienced several outbreaks in recent years, highlighting its vulnerability to this deadly disease. In 2018, a significant outbreak in Kerala claimed the lives of 17 people and prompted widespread fear and concern. The 2018 outbreak served as a stark reminder of the devastating impact Nipah virus can have. It also highlighted the importance of robust surveillance systems, rapid response mechanisms, and effective public health measures in containing outbreaks and minimizing casualties. Since the 2018 outbreak, Kerala has made significant strides in strengthening its preparedness and response capabilities. The state has implemented enhanced surveillance measures, established dedicated Nipah virus treatment centers, and conducted extensive public awareness campaigns to educate the population about the virus and its prevention.